Hi, I'm Steve. I'm going to be doing a tracheal tube suctioning video today, and I'm going to start recording it now. And during the process, I'm going to have to move the camera. Um, there'll be two stages in the beginning when I'm not sterile, and after when I'm using sterile technique. I'll move the camera before I do that. First of all, my supplies. I have a drape. I have a catheter set, a suction catheter set. I have a pair of sterile gloves. I have a pair of clean gloves. I have some hand cleaning material. I have some saline, 0.9% saline. I have a watch. I have a little card that's blank, that I'll be recording information on at the end of the procedure. With the patient, I have an ambu bag to give them some oxygen. I have a suction container. I have a blood pressure cuff, an oximeter, and my stethoscope. So next what I'm going to do is walk in the patient's room and identify myself. Hi, Mr. Jones. My name is Steve. I'm going to be your nurse today. I'm going to clean my hands. I'm going to clean my hands. And next what I'm going to do is check the patient's identification bracelet and ask them, can you tell me what your name is? And can you tell me what your date of birth is? Next, I'm going to pull a drape around the patient before I start the procedure for privacy. So now that I've identified the patient, I'm going to raise the bed to a working height, which it's at. I'm going to make sure that the patient is at in Fowler's position, about a 45-degree Fowler's position, which he's at. And I have the suction tubing here that I'll be able to use. And I'm going to explain to the patient basically that I'm going to be Mr. Jones. I'm going to be doing a tracheal tube suctioning on you today, and it should give you some relief from the congestion that you may be having in your chest. Now, before I start any assessment, I'm also going to make sure my suction tubing is on at 120 to 150, and so that it's ready to plug in when I start the procedure and I have sterile gloves on. So I've explained the procedure to the patient. Next, what I'm going to do is clean it, since I'm going to have to assess the patient before I start this procedure. I'm going to have to clean my hands. I'm cleaning my hands, and I'm putting on a pair of clean gloves. In order to assess the patient. Next, what I'm going to do is put a drape underneath his catheter, suction tube area, like that. And in order to assess the patient, what I'm going to do is first check for his level of consciousness. He's awake and alert. I'm going to check for any signs of hypoxia. Is the patient anxious? Is he showing any cyanosis? Next, I'm going to check the pulse oximeter for his oxygen level. I'm going to take a blood pressure. And while I'm taking the blood pressure, I'm going to take the blood pressure. Next, I'm going to take his pulse. And while I'm taking his pulse and timing it, I'm going to wait till I take a 30-second pulse, and then I'm going to be watching his respirations. I'm going to watch for rate, and I'm going to watch for depth of respirations to make sure that I have those numbers in my head. I'm not going to write them down at this point. After I've assessed the patient, I'm going to explain to him I'm going to be starting the procedure soon. And what I need to do now is I'm going to move the camera so that Oh, I need to also do one last thing during the assessment, which is very important. I'm going to check his respiration rate, his respirations. Take a deep breath, please. Take a deep breath. Okay, and I've listened to his lungs, which is very important because I'm going to be doing that again later. So now I need to change the position of the camera. I'm going to take off my gloves, my clean gloves, and I'm going to clean my hands and change the position of the camera. Hello, I'm back. You may not be able to see my head, but hopefully you'll be able to see my hands. And as I open up the suction kit, what I'll be doing there, I'm all ready to start the procedure. I've done my patient assessment. Again, I'm always being alert for any changes or signs that the patient's becoming hypoxic at any point in this procedure. I'll be regularly checking his oximeter, and I'll be regularly checking to make sure he doesn't become anxious, that he's not showing any signs of respiratory distress. The next step is I have my suction catheter kit. I'm going to clean my hands. I have my hands nice and clean now. I'm going to open up the suction catheter kit from the corner, and I'm not going to touch anything inside. And I'm going to peel this back without touching anything inside. Hopefully you can see what I'm doing. And I can touch the outer edge, but that's about all I'm allowed to touch. That's all I'm going to touch, is the outer edge, so that I can get access to the container that's inside. There's a container that I'm going to be putting sterile saline on in order to clean the catheter. As you can see, I'm going to pick this up without touching anything. I'm just touching the container, and I'm going to close this back up and put it here. I'm going to open up the container without touching the inside of it, which is sterile, and I'm going to put the container here. Next, what I'm going to do is open my saline. I have saline. I'm going to open it up, and I'm going to make sure to keep the cap sterile at all times. I can put it down. I'm going to hold it up. Well, I'm going to put it down with it up, and I'm going to hold this with this label out. I'm going to pour some saline in. I'm pouring some saline in, and then I'm going to put the cap back on. Next, what I'm going to do is open this up completely so that I have access to the catheter, the suction catheter, when I'm sterile, when I have sterile gloves on. And that's that. And this shouldn't touch anything either. Next, I have my sterile gloves, which I hope you can see here. Here are my sterile gloves. I'm going to open up the package, and I can touch the gloves, outer package. Next, what I'm going to do, and I hope you can see all this with that over there, I'm going to open up the package. I'm going to turn it around. So right is right and left is left. I'm going to open this up without touching anything inside because it's sterile inside. I hope you can see what I'm doing. Okay. And next I'm going to open up these flaps to make sure I don't touch the gloves or the inside of this package at all because it's sterile. Next, what I'm going to do is take the dominant glove and I'm going to pick it up at the edge without touching the inside of it. And what I'm going to do is I'm going to put my hand in the glove above waist level, not touching it to anything, and put the glove on. As you can see. Next, what I'm going to do is take the non-dominant glove. Hopefully you can see me picking it up with 4 fingers. I'm going to put this on my left hand with my thumb up, not to touch my hand. And I'm going to put that glove on without touching it, the end of it. Next, I'm going to fix the gloves so that they're on properly. The next step is I'm going to tell the patient I'm going to be starting the procedure. I'm going to check him to make sure there's no hypoxia. I'm going to check his O2. I'm going to keep my sterile gloves sterile. And I'm checking his respiration rate. And I'm all set to go. What I'm going to do next is pick up the suction catheter from the sterile kit. And I'm going to pull it out of the package. I'm going to wrap this around my hand just a bit so that I'll be able to plug it into the suction catheter that's attached to the suction container. So I'm going to do that. Now this hand is no longer sterile, my non-dominant hand. I'm going to plug this in securely, keeping the tip away. And next, while I'm doing this hand is not sterile anymore. I'm going to move this away. And now for the rest of the time here, I'm going to really make sure that he shows no signs of respiratory distress. I'm going to tell him I'm going to start the procedure. I'm going to give him 2 breaths of oxygen. 1, 2, and then I'm going to insert the catheter without my hand on the suction yet. And I'm going to make sure I don't touch anything when I do that as I insert it. I cannot touch the outside of this. Okay, I didn't touch anything when I did that. And I'm inserting this until I feel the carina. Once I feel the carina, and now I'm going to be very aware of any respiratory distress by the patient. I'm going to pull back from the carina, and then I'm going to start doing intermittent suction for no longer than 10 seconds as I remove this. And that's my first suctioning. I'm going to give him back his oxygen, assess his condition, and then I'm going to wait a minute before I do the next suctioning. But in the meantime, I'm going to clean out my suction catheter with a full suction and make sure that the catheter tip is clean. Next, what I'm going to do is I wait a minute. I'm going to remove this again, check the patient's condition, give him 2 breaths of oxygen, and again I'm going to insert the catheter without suction until I get through this hole without touching anything, which I did. I didn't touch any of the outside of it, the tip. I'm going to insert it until I feel the carina, come back a little bit, and then intermittently suction as I withdraw the tube. Next, I'm going to give him back his oxygen, make sure he's comfortable, check his pulse oximeter, check for any signs of respiratory distress. In the meantime, I'm going to also check his respirations to see whether they've improved or not. Can you take a deep breath for me, please? Take a deep breath for me, please. Patient's clear. So now I can dispose of my materials. And the procedure's complete. I'm going to remove my gloves, which they broke. I'm going to make sure I clean my hands real well due to the break in the gloves. Make sure they're nice and clean. I can pick up my card now that my hands are clean. I'm going to write down the contents of the container. I'm going to write down the consistency of the material. If there's any odor, I'll pick it up. I'll go over and check it for odor. But right now I don't smell anything coming out of the opening. I'm going to check for color. I'm going to check the amount. And I'm going to write down how well the patient tolerated the procedure, which he tolerated it very well. After this is all done and I clean the patient up, I'm going to raise the patient back up to proper height, lower his head if he'd like me to, and that's the end of my demonstration. Thank you.